So that being said, that's why I really encouraged my mother to get away from dairy products, but she just really loved dairy, right? So I was really searching for a non-dairy ice cream that she could like. I agree with you. The coconut-based ones aren't good because they taste like coconut, and it just didn't work. The yogurt-based ones didn't mimic ice cream very well. But there are other varieties out there that actually are really good. Ben & Jerry's has one that's awesome. There's So Delicious has a really good one. And there are varieties out there that actually my mother likes, and my mother is not vegan, okay? She's like, in fact, I keep telling her that I'm gonna wait till she becomes disabled and then force her to be vegan. But she actually really likes these, there are a couple of varieties of non-dairy ice cream that she likes that mimic the taste, texture of regular ice cream, and she's okay with it. So there are good ones out there that really mimic the ice cream, and you won't miss it. So just keep trying; you'll find one that are really good. There are some really good. I think So Delicious has some Dove bars, chocolate color covered non-dairy Dove bars that are awesome. Now, yes, sir.
So what if, rather than that, they were off of SOS foods? Sugar, oil, and salt.
What
SOS. Sugar, oil, and salt.
You're saying that you should avoid them?
No, I mean, no. I've been plant-based for a while now, and I've been on a sugar, oil, salt-free thing, and I found it benefits the mind and and everything like that. But being, not on dairy, like just taking like some frozen bananas and turning that into your ice cream, pretty much, without having to add much, just like some cinnamon.
Well, yes, you're trying to really limit your exposure to sugar, oil, and salt isn't a very good idea, because yes, those things are can be very unhealthy, and yes, that is a really positive move. I agree. Next question.
I have a question. What's a good source of B12, vitamin B6 and 12?
Okay. So the question is, what is a source of B6 and B12? Let's talk about B12, because that's a special case. So anybody that is on a plant-based diet has to take a B12 supplement. And people have pointed to that as possibly indicating that there is something problematic with a plant-based diet. They're like, well, wait a minute. If you've got to take a B12 supplement, that means that a plant-based diet is unnatural, right? No, it doesn't. Why? Because all B12 is made by bacteria. Okay? All B12. All B12 is made by bacteria. No plant makes B12. No animal makes B12. All B12 is made by bacteria. Any B12 that is found in an animal food came from the bacteria, and the animal ate the bacteria, and that's how it ended up in the animal's tissues. If we were living in a natural environment, we would get B12 from our water, we would get it from the soil, we would get it from the plant foods that we got out of our environment. But in these artificial environments we've created for ourselves, we sterilize our water, we excessively wash our food, and we've eliminated the natural sources of B12 from our environment, which is why we have to take the supplement. Okay? That's why. So we should make sure we take the B12 supplement, because we don't have the natural sources in the environment anymore. That's the only reason. B6 is B vitamin that you will get from eating a wide variety of plant foods. It's not hard to get. Just make sure you eat a wide range of vegetables and grains and legumes, and you will get enough B6. It's not a problem. Okay. Yes, sir.
Speaking.
Okay. So the question. Okay. So the question was, can everyone thrive on a raw diet? Sure. So a raw diet means that all of the food that a person eats, and well, we're talking about a raw vegan diet, a raw plant-based diet. So the question is, can everybody thrive on a raw plant-based diet? That depends on how that raw plant-based diet is formulated. It can be a healthy raw plant-based diet, or it can be one that is not that well constructed. What do I mean by that? I have seen people on a raw plant-based diet that eat a lot of bananas and a lot of lettuce. That's not a well-formulated raw diet, okay? If you are going to be on a completely raw plant-based diet and you want a balanced raw plant-based diet, you need to make sure that you are eating from a wide variety of plant foods. And some of the plant foods that are harder or that take more preparation to get on a raw diet are your legumes, like beans, right? Well, think about dry beans. How do you eat dry beans on a raw diet? You have to sprout them. Same thing with your grains. You can't take like rice. Brown rice is a grain, right? You can't just sit there and chew brown rice, but you can eat it if you sprout it. If you put it in water and let the rice germinate, then you can eat it. Same thing with, like, say, pinto beans or black-eyed peas. If you allow the beans to start to, then they're easy to eat. So then you can get all of the nutrients in those beans, and they're much easier to assimilate, and you can include them in your diet. And then you are including your legumes, you're including your grains, and the diet is much more balanced. But again, that takes more planning. You can make sure you're including your nuts and so forth. So it is possible with appropriate planning to get to a very healthy and balanced raw diet. But as I said, it just takes a lot of planning and a good prep work.
But you can go from eating meat and jump right into a raw diet.
Again, if you're wealthy enough and have enough time, if you have enough money and enough prep time, yeah, you can. But most people don't have that. I would say that most people don't have that ability. You know what I mean? They just the average person isn't kind of just doesn't have that that much information and knowledge and prep time to do that. But if you did, you could. But it just, again, you need to be able to do the work to make it work. Oh yeah, I mean, again, a well-planned, well-prepared raw diet that gives you the calories that you need is incredibly healthy for you. So it can be done, but it just has to be done properly.
Question.
Okay.
Question here.
Yes.
Is there a natural remedy for fatty liver?
Yes. Fatty liver has been shown to be reversed on a healthy, low-fat, balanced plant-based diet. It can be reversed, yes. Yes, okay, that's a question back. I'll come
Okay.
back to you in a minute. Yes, in the back.
Recently, I was diagnosed with pre-diabetes.
Uh-huh.
I told them that I do not want any pills for it. I will try to eat it away. Now, I don't know what
Who am
my
I talking to?
numbers. I don't know what my numbers are supposed to be. When I took that blood test that first time, it showed 6.7.
Okay, that must have been your hemoglobin A1C.
No, 6.4. This evening, I want to know from you, what should my numbers be, as I am testing regularly? And what can I eat not to take those pills?
Okay. All right. So I'm my assumption is that when you say it was 6.7 or 6.4, you're talking about your A1C, correct?
Yes.
Okay.
Yes.
All right. A person without diabetes who gets their A1C checked, their A1C would probably be something like 5.2 or 5.4. Between
Okay.
5.2 to 5.4. I don't know what your diet is like. I don't know if you're completely plant-based. And if you're not completely plant-based, I would want you to become completely plant-based, and I would
Okay.
want you to become healthy plant-based.
Yes.
Because you can eat potato chips and soy delicious ice cream and be plant-based, but that's not healthy plant-based.
Right.
So I'd want you to be whole food, low oil, plant-based, and we could almost certainly get you down to a normal A1C and make sure. Can we fix that? Thank you. And keep you off the medicines.
Okay.
Just so you guys know, I have had patients who've had diabetes for 17 years, hemoglobin A1Cs of greater than 10, on insulin twice a day plus pills, who went completely vegan, whole food, plant-based, and got off all their meds. Okay? You can reverse diabetes if you're willing to make the appropriate diet and lifestyle changes. But you just have to be willing to give up, dead animals and processed foods.
Yeah, I am trying, but I still want to know, how far should I come down?
Huh? Just one second. All right. Yeah. Okay. We're going to bring the rest of the panel up in probably, I think, about 5 minutes. Yeah. Yep. Okay.
Okay.
So the bottom line is, yes, it can be done. We just have to get you on the right diet.
Okay.
Okay.
Thank you.
All right.
One more question. What do I do for my knee pain?
That's like asking me, how do we get world peace? I mean, it depends on what's wrong with your knee, and that's a harder question to answer. All right, yes, sir. Let me get you real quick.
Lorna Thomas for cancer.
I'm sorry?
Are you for the cancer prevention?
Am I from?
Are you for cancer prevention? Okay.
Oh, no, yeah, there's somebody else.
I wanted to ask you, as a over 11-and-a-half-year-old pediatric, now adult brain cancer patient, who survived his first roundabout treatment of radiation, chemotherapy, and stuff like that, and is still doing a little chemotherapy and a little bit of radiation, I guess you could say, through MRIs and whatnot. Just doing like, the bare minimum, not of a plant-based diet, doing the maximum thereof, and trying to do the best that you can. I know that brain cancer is considered to be incurable by most doctors, but also, what are good psychological and mindfulness things to do around the area of fighting cancer?
Sure. Okay.
I already have most of these, 10 preventative cancer things that, taken care of pretty much, with the exception of the fact that I'm not able to go outside and then get stuff because I've had seizures and stuff, and I've acted, on the other side of, mindfulness.
Sure.
Yeah.
Well, one thing I want to say to you is that don't accept that your cancer is necessarily incurable. I want to encourage you to keep doing the plant-based things, and because you may be able to get that cancer into remission and keep it there with diet changes. Part of the issue with these pediatric problems is that a lot of them have never been
Seen before.
treated with diet change.
And as I found out, as being one of the only people in my field, not discovering, but learning myself as well. There's loads of people that have died all around me, that have had the same or not so different, type of thing, and that can, lead to depression and things like that. So I've had to strongly trust in God that, I won't be one of those people, and that I just keep on moving on. And I've been eating a very healthy plant-based diet. I'm the type of person that will go to the Golden Corral salad bar and take all those spinach leaves and just plop them on my salad plate, and go get some fresh fruit and stuff like that, and not have to deal with all the other cakes and stuff like that.
Yeah. All right. Yeah. Why don't we talk afterwards? And yeah, we'll talk about some things. There's one lady over here I want to get to, and we'll talk a little bit later. Okay. Okay. Yes, sir.
You mentioned that dairy has a lot of estrogen. Now, naturally, coming from
You're gonna ask me about soy, ain't you?
Yes, sir.
Yes. I'm so glad you asked that question. Soy is good for you. Okay? Do not believe the hype. China, Japan eat more soy than any place on earth, and the men are not wearing bras, and the women have less breast cancer than any place on earth. Okay? So phytoestrogens are protective. They actually block the estrogen receptor in women and lower the risk for breast cancer, and they lower the risk for prostate cancer in men. They don't act like real estrogens. They are protective. The idea that they increase the risk was put out by the dairy industry to try and scare people. If you read all the studies, they are protective both before and after menopause. They are protective for women who have had cancer and women who haven't had cancer. So yeah, they are. Soy is good for us. All right. Is it time to bring? I think it's time to bring the panel up, right?
Hello. There's a new product out called Golo. Are you familiar with that? And is that something that we need to be concerned about?
I think Golo is more of a system of weight loss, isn't it? I don't think it's an actual product.
I'm not sure.
Yeah, I think it's a system, a psychological system that tries to look into why people eat the things they eat to try and help you figure out why you overeat. I don't think it's an actual weight loss product. That's my understanding.
Okay.
Yeah. Okay. You want to bring the panel up now?
Yes.
What? All right. We got a quickie. Got time for a quickie.
What is one of the most effective ways to unclog your arteries?
One of the most effective ways to unclog your arteries is reducing the amount of fat in your diet down to less than 15%, and eliminating all animal protein and all dairy. Sir? Okay, no, I'm just going to tell him. Sir, about the clogged arteries, order Caldwell Esselstyn's book, Preventing and Reversing Heart Disease. He goes into all of that. And he has Dr. Caldwell Esselstyn. If you see me afterwards, I can actually show you a picture of the book. It's called Preventing and Reversing Heart Disease. He's got pictures of before and after pictures of people who went on his dietary program and reversed their heart disease. Clogged to unclogged arteries.